Welcome back to the show. Now that you've got your room looking nice and you're feeling pretty good about yourself, why not try to make yourself look a little better, right? I'm joined now with Dr. David Berman at the Berman Skin Institute in Palo Alto. Welcome to the show.
Thank you very much.
We know each other well because I'm a patient.
That's right, Lisa.
It's been a while since I've been in. Tell me about what women ask for. What are the most popular procedures you do?
Well, from a more invasive point of view, liposuction is the #1 cosmetic surgical procedure.
Really?
From a non-invasive point of view, Botox is still #1, and it has been for about 5 or 6 years. So I'd say Botox, fillers, especially in the midst of an economic depression we've had in the last few months, or last year or so, Botox numbers have been skyrocketing. People can't afford the bigger procedures, and this is a very short lunchtime procedure that people can afford, and they can go right back to work or play
without
after.
looking damaged. I've had this done, but I'm going to ask you for those that haven't. How invasive is Botox? You're not getting the one shot.
Yeah. So this is a purified protein, and we're injecting it in a multitude of different areas. So patients come in, it takes about a minute or so. Patients are very comfortable, and there's really no downtime whatsoever. So we could do a little bit on you if you'd like.
The things I do for this job. We're also going to do fillers. Tell me a little bit about lasers, too, because I know a lot of people are coming in to do laser treatments. What can you have done?
Well, the pendulum has really swung from very aggressive procedures to things that really were just snake oils and things that didn't deliver to, I think now, a happy medium where we have fractionated devices that offer really minimal to no downtime. Lasers for hair removal. There are lasers to tighten skin. We have lasers to get rid of tattoos or for brown discoloration or broken capillaries. So we really do have a variety of things available today, and the majority of patients coming in are asking for these no downtime procedures. So,
you know, the reason I started getting Botox to begin with is because I wanted to look lovely, but I also had this look like an 11, and it made me look angry all the time, and especially being on camera, I didn't want to look angry all the time. That's a Botox thing.
Yeah, the glabellar lines here certainly can be readily treated with a little Botox injection. We'll do 5 little injections today, and as you can see, we'll do it right in the middle, 2 here, and then 1 on either side. And I'd say within 1 to 2 days, you'll see these lines diminishing, if not completely gone. Botox works in 2 ways. It, #1, relaxes muscles, and that happens pretty quickly within the first week or so. But as the muscles relax, those muscles thin down to their more normal state. So you'll see continued benefits, and they last about 4 to 6 months, and the patients do need to come back in for a repeat treatment. But it is a great complementary procedure to fillers that we use into the nasal labial folds, the tear troughs, very popular. In fact, I find that to be one of the most desirable areas because it
you get
lasts so long.
sort of the bags under the eyes, and then these get really deep. And what about those wrinkles that you get right here? The women hate those the worst. What are the treatments for that when they start getting bad?
Well, we used to do more aggressive treatments such as the CO2 laser. Now we're doing fractionated devices more often because people just don't want the downtime. So certainly Botox can be done, or fillers can be done. You have beautiful lips, so I don't think we need to do that for you, but there are a myriad of options for you. So.
All right, one last question that I get from a lot of ladies: the neck, the jawline in the neck, when it starts to slip a little bit, is, you know, I think immediately think of the big facelift, you know, that you got to pull everything back. Are there any little things you can do before you?
Yeah, and so what ends up happening is we age. We end up having skin hanging on a diminishing base. We lose fat on our face. We may lose it here, we may lose it in the tear troughs, we may gain it on the hips. So we gain it here, but we lose it in our face. And to regain that more youthful fullness, we want to replenish fat or fullness. And we can do that either by taking fat from one place to another or doing fillers. Sculptra is an injectable filler that we could do in a very short order within about 5 or 10 minutes. And we could replenish the fullness of the face so that your skin is tighter, and it could actually lift that skin up over the jawline.
Does Madonna have cheek implants?
I wouldn't know. I'm not an artist.
But
patient confidential.
Is that why you get cheek implants? Is to pull this up? Is that why you get them?
And you can do cheek implants that are surgically oriented, or you could do them non-surgically in 5 minutes, 6 minutes using a filler agent. So that's become very popular. Botox is also very, very elegant in this area of the crow's feet. Without having any downtime, 3 little injections on either side, and those lines disappear.
You're the only one that I've ever gone to where you don't... I've had this happen before, and especially being on camera, it's just awful. what are people doing? I mean, I guess the point being, you got to be really careful who you go to, because doctors can go like on a weekend class, and you're not really going to a professional on that level.
Yeah, I think anybody could do Botox as far as doctors, nurses, and so I think experience matters. Going to a plastic surgeon or a dermatologist who specializes in this is important. But you're right, taking a very conservative approach and doing less is more. You know, we really want to go conservative with patients, and we could always add more Botox or more fillers 2 weeks down the road. So the key is to distribute that medicine evenly so you don't have that quizzical or spot look.
Yeah, you just look surprised all the time. You did it again. I love this. Very subtle.
Yeah.
And then how long am I going to wait for this to
You'll be
kick
seeing
in?
results by tomorrow morning probably. So, but give it a good week or so for it to really thoroughly kick in. So.
Nice, nice, nice. Well, I sure appreciate you having me in today and allowing the cameras to come in.
Thanks for having me, Lisa.
That's about all the time we've got. So Dr. Berman and I are going to say goodbye. We'll see you next week. I'm Lisa Quinn.
Bye-bye.
I'm Dr. Berman.
Take care.